Hello, I haven't done one of these videos in quite some time. It's been, I suppose, about half a year at least. If you had watched any of my previous videos from March or April, especially April or May, I think May had been the last one I did, perhaps you noticed that I wasn't looking too good. I had cancer. I had prostate cancer. Technically, I still do. But it's kind of an interesting story. I've written an entire book about it that just came out this September 2020, and I'll show you something about that at the end of this talk. But I don't want to rehash everything that's in the book. I don't even like talking in any detail. I don't like thinking in any detail about March and April and May of this year. Basically, I went to two different clinics. I just got kicked around like an old can. The diagnosis of cancer took 2 months to be arrived at. Some of you men know what a PSA test is. That's the basic test that would be done instantly if there were ever any suspicion that a man might have prostate cancer. It took about 2 months for that to be done, and then it took another month for the clinic of these two that did it to tell me about it. You hear from doctors, and you can find out online that it takes 7 to 10 days to hear back about your PSA. Actually, no, it takes about 24 hours, maybe 48. But in this country, we have people lined up so long, like airplanes waiting to take off at LaGuardia, so it does take over a week probably. It doesn't have to be that way. It's because our doctors are so overbooked, and I'm not going to say that's just because they like to make lots of money, but perhaps that's part of the motive. I don't know what the motive was for my being constantly pushed to the back and ignored. I don't know. Was it COVID-19? One of the clinics told me that that was part of the problem. I don't really believe that, because, I mean, why did they see me at all? If they're going to see me at all, knowing what my condition was, it seems like the first thing they would have done would do the essential test. Anyway, I'm not going to get all worked up about this. I'd also like to talk about in subsequent videos from this series that I'm trying to create, my experience after I found that I had not only prostate cancer but metastatic prostate cancer. It was starting to spread into my bones. I was the one that arranged the bone scan because the clinic that I was using couldn't be bothered to do it promptly, so I did that, and then the doctor was going to call me back with the result. The scan had to be arranged through the doctor, because, you know, he's the expert, and you can't just leave this stuff in the hands of private citizens, can we? Well, he was going to see me a couple of weeks later, but I was able to create a patient portal and go into the place that did the hospital that did the scan, and that's how I found out, prying into my records and reading the narrative results, that I had metastatic cancer, stage 4 prostate cancer. With my son's help, however, the story had a happy ending. I was able immediately, I mean within a week, to get in to see Carlos Bautista and his staff at the Immunity Therapy Center in Tijuana, Mexico. Actually, Dr. Bautista, I understand, did most of his study in Germany, in Europe. So this isn't some little fly-by-night spa where they give you limeade and charge you a fortune for it and give you herbs and pills from the curandera on the corner of the, I mean, no. This is multiple techniques. It's not just one technique, but ITC uses multiple ways, all of which have science behind them to some degree. The science is perhaps not as certain in some cases as in others, but hey, I'm proof. I'm living proof that they did something right, because my PSA number when I went out there, the first blood test they gave me, I scored a whopping 295. I don't know anyone who's ever heard of a number that high for a PSA. When I left, it was after, actually the blood test I had was a little before I left. It was about 4.5 weeks down the road after checking in. My PSA was 4.3. And I've continued after returning home with therapies, medications, a few injections. And the last time my blood was tested, I was 0.8. So I have to continue to fight this thing, but I don't know that technically I'm in remission because I'm still doing therapies and taking supplements. But I want to talk about that. I want to talk about some of the, in future videos. The very next video I'm going to do, in fact, will show you a lot of the things that I continue to do every day, which I learned about in Tijuana. But there's something wrong here, isn't there? Now, my name is John Harris, by the way, and I'm making this video for my revised site, semperluxmundi.org. And Semper Lux Mundi is Latin for always the light of the world. You can probably conclude that there's a religious intent behind that. I would like to ultimately give a spin to these discussions that points to raising our sights to some higher reality. That's certainly been the most important lesson that I learned from this. I don't expect to live forever, even with my cancer in remission. I'm going to die of something. So are you. So is everybody. We're not going to live forever in this world, but we should be able to tell each other the truth. We should be able to, those of us who are healers should have honest motives. We should, those of us who are patients should be able to pursue our options with a certain freedom, which is in accordance with our dignity. We shouldn't have a narrow range of options presented to us by some bureaucratic death panel. That was very much the experience I had in this country. I'm not anti-American. I consider myself a patriot. In fact, I'm very aggrieved that my country does such a miserable job of saving people's lives who have cancer, because there's so much more that can be done. And in fact, I would imagine that a lot of the technologies that Dr. Bautista studied in Germany were originated or developed in America, but we can't offer them here. They might be offered on some flagship universities' medical program. I've heard of people who enter studies and have similar happy results, but that sort of thing isn't open to the average person. And there are innovative clinics that are open in the U.S., but your insurance isn't going to pay for it. Medicare's not going to pay for it. You can't deduct travel expenses from your taxes. You know, the system is rigged to keep you narrowly treading down this path of having surgery and chemo and radiation, which actually may, of course, do some good in some measure, but those are the only three options that we're allowed to use. Everything else is, well, you have to pay for that out of pocket because it's voodoo. And again, I'm living proof that that's a lie. It disturbs me that it's a lie. It disturbs me that our system is lying about that being a lie. I think I'll just wrap this up. I'm wandering all over the place because because I find this painful to talk about. I should have sat down and made some notes about everything that I wanted to hit in this introductory video, but I don't like to think about it. I'll refer you to my book again in just a moment, but as I say, this is an introduction, and the video that's immediately going to follow this is going to show you some of the specific therapies and technologies that I have here at my home, which I think they continue to be effective. But I'll leave off with a little anecdote. After I got home, I developed something called Bell's palsy. And that's why I don't know if you can tell this, but I can certainly hear it in my own speech. I have a little bit of a lisp because what happens with Bell's palsy, I thought at first I was having a stroke. It paralyzes one side of your face, and that was my right side. I could not shut my eyelid. I could not smile with, I'd smile like that, but I couldn't chew. I could chew on one side of my mouth, but not the other. My right ear was sore, the back of my neck was sore. The doctor at the emergency room was great. He just went down all the symptoms and checked them, all the boxes. And yeah, doc, that's what I've got. It wasn't a stroke. He even took a brain scan. I guess it made me think of the headline about Dizzy Dean when he got concussion in the World Series. The next day, the St. Louis paper said, X-rays of Dean's brain show nothing. Well, the X-ray of my brain showed nothing. I was clear in terms of a brain tumor. But I was recommended to a neurologist whom I went to see the following week. And the neurologist decided that he would just kind of, my wife calls it thinking out loud, and she says all doctors do this. Isn't that great that our American doctors, this is their bedside manner? He was just kind of thinking out loud, and he thought, well, I'll look into that. Maybe you got a brain, an incipient brain tumor at the base of your skull, and that's paralyzing half of your face. It didn't matter that the symptoms were already starting to alleviate. It didn't matter that he had the X-ray in front of him that showed that I was clean. He just decided to just leak out a few words that would let me go home wondering again if I was at death's door. Well, that was a month ago, and except for the little bit of a slur, I have absolutely no symptoms at all. So I've come out of this very quickly. But why do doctors do this? What's going on with our American medical system? Why do doctors have this attitude that they're bigger than life, that they're some kind of deity? Why do they treat us like this? One of the most important things that I think I learned in Mexico was that when you're surrounded by caring, loving people who are real down-to-earth people, and they build you up, and they're constantly, yeah, you can do this, it's going to be okay. That just attitude is so important from getting cured of diseases like cancer, just attitude. So why would you take that kind of attitude, which I encountered also in my primary urologist who was ready to nail the board shut on my coffin before I went to Tijuana. He'd written me off as dead. Why do they do that? What is going on? Well, I don't know exactly what I'm going to say about that in future videos, but I feel compelled to say a little more. And here is the book that I was talking about. The title is Why I'm Not Dead. You can buy the hard copy or a Kindle download on Amazon. Sometimes the Kindle download is available as a free promotion. I'm trying to do that at the beginning of every month, so keep your eye out for that if that appeals to you. The Kindle's only, I think, the price is $3.79. Look, this is a book of hope. It's, as the title suggests, it's pretty direct. I don't pull any punches here. I talk about some of my own views of things. My attitudes are reflected in it, but this is a factual story of the ordeal that I was put through by our medical system, and the hope and the rescue, the new life, the redemption that I found in alternative medicine. So if you are going through something like this yourself, or you know someone who's going through a similar struggle with cancer, consider this book. I think you'll enjoy it.